Have you ever wondered what questions might be off limits when talking with your surgeon? It may seem like a strange thought, but communication between patient and surgeon is a delicate balance. It's crucial, yet there are boundaries. There are certain questions that, while they may seem important to you, could be inappropriate or even counterproductive. It's not about keeping secrets, but about fostering mutual respect and understanding. So, are you ready to explore this intriguing topic? Today, we dive into the 6 questions you should never ask your surgeon. The first question on our list is, will I survive this surgery? Now, this may seem like a natural question to ask, especially when you're anxious about an impending operation. But let's consider why this question might put surgeons in a tricky spot. You see, medicine is a science, but it's not an exact one. Every surgery, no matter how routine, carries a certain degree of risk and uncertainty. Asking your surgeon for a guarantee of survival is like asking a weather forecaster to promise it won't rain on your wedding day 6 months from now. In essence, you're asking your surgeon to predict the unpredictable, which isn't fair to them or helpful to you. It's crucial to remember that surgeons are highly trained professionals who've spent years honing their skills and knowledge. The aim of every surgeon is to ensure the best possible outcome for their patients. So instead of focusing on the fear of not surviving, shift your attention to understanding the procedure better. Build trust in your surgeon's competence and experience. Ask about the risks involved, the success rate of the surgery, and any alternative treatments available. This approach will provide you with factual information that can help alleviate your fears and equip you with a realistic understanding of what to expect. So, rather than asking if you'll survive, ask about risks, success rates, and other factual information. The second question you should avoid is, have you ever made a mistake during a surgery? This question may seem innocuous, but it can put surgeons in a difficult position. It's important to remember that surgeons, like all of us, are human. They're not infallible, and mistakes, though rare, can occur. The field of medicine is one of constant learning and evolution. Every surgeon, no matter how experienced, continuously learns and evolves with each procedure they perform. This includes learning from unexpected situations that may arise during a surgery. However, these are not necessarily mistakes in the traditional sense, but rather opportunities for growth and improvement. Asking a surgeon about a mistake may not contribute to a productive conversation. It could potentially create an uncomfortable atmosphere of doubt and suspicion. Surgeons are professionals who strive to provide the best possible care for their patients. They work in a field where precision, knowledge, and skill are paramount, and they take their responsibilities very seriously. Instead of asking about past mistakes, a more productive question might be about their experience and how they handle unexpected situations. This gives the surgeon an opportunity to discuss their problem-solving skills, their adaptability, and their ability to handle pressure. It allows you to gain insight into their expertise and competence rather than focusing on the rare possibility of a mistake. Instead, ask about their experience and how they handle unexpected situations. Next up, is this procedure really necessary? This query may seem harmless, a simple quest for understanding. However, it can be problematic as it implicitly questions the surgeon's professional judgment. Surgeons recommend procedures based on comprehensive evaluations and their expert knowledge. They consider your health history, the severity of your condition, and the latest medical research. When you ask, is this procedure really necessary? You might be unintentionally implying doubt in their expertise. It's essential to remember that surgeons have spent many years studying and practicing their craft. They are not just randomly choosing procedures, their recommendations are backed by a wealth of experience and knowledge. This isn't to say that you shouldn't seek clarity about your medical situation. Quite the contrary, it's vital that you understand what's happening with your health. But instead of questioning the necessity of the procedure, your goal should be to gain a better understanding of why it's being recommended. Ask your surgeon about the reasons behind the recommendation. What are the potential benefits of this procedure? What might happen if you decide not to go ahead with it? Are there any alternatives? Such questions show your interest in understanding your health situation better, without undermining the surgeon's expertise. So, the next time you feel the urge to ask, is this procedure really necessary? Remember to reframe the question in a way that respects the surgeon's judgment while satisfying your need for information. Instead, ask for more information about the benefits and alternatives to the proposed procedure. Our fourth and fifth questions to avoid are, can I get a discount? And can my family member assist during the surgery? Now, these may sound like unusual queries, but they do come up more often than you'd think. Let's unpack why they're not quite suitable. First off, can I get a discount? This isn't like haggling over a rug at a flea market or negotiating a better deal on a used car. Surgery is a highly skilled, complex service provided by trained professionals. It requires years of education, countless hours of practice, and a thorough understanding of the human body. The costs associated with surgery aren't arbitrary. They cover the surgeon's expertise, the anesthesiologist's time, the operating room equipment, the hospital stay. The list goes on. While it's understandable to be concerned about the financial aspects of surgery, asking for a discount undermines the value of these professionals' work and the seriousness of the procedure. It's much more appropriate to discuss financing options or insurance coverage with the hospital's billing department or your insurance provider. Now, on to the second question. Can my family member assist during the surgery? This may be asked out of concern, or perhaps the desire to be involved in a loved one's care. However, it's important to remember that surgery isn't a DIY project or a family activity. It's a critical procedure that requires a team of trained medical professionals to ensure everything goes as smoothly and safely as possible. Having an untrained person in the operating room can compromise the sterile environment, distract the surgical team, and even put the patient at risk. If you wish to support a loved one during their surgical journey, there are plenty of other ways to do so. Stay informed about their condition, be there for them emotionally, and trust the medical team to do their job. Remember, surgery isn't a marketplace or a family activity. It's a professional medical procedure. Trust in the skills and knowledge of your medical team. They're there to provide the best care possible in the most professional manner. Finally, can you guarantee success? This question, while seemingly straightforward, is not one that any surgeon can answer with absolute certainty. Medicine, as with many fields, is not an exact science. Each body is unique, each person's health status varied, and each procedure comes with its own set of variables and risks. When you ask for a guarantee, you're seeking an assurance that is simply unattainable. Even the most skilled surgeon cannot predict the exact outcome of a procedure. This is due to numerous factors such as the patient's overall health, the complexity of the procedure, and even the unpredictability of the human body. It's important to understand that surgery is not without risk. There can be complications, unexpected occurrences, and sometimes the results may not be what was anticipated. This does not necessarily reflect a surgeon's competency or skill. It's simply a reality of medicine. So instead of asking for a guarantee, shift your question to focus on the measures in place to maximize the chances of success. Ask about the surgeon's experience with the procedure, the steps they take to mitigate risks, and the post-operative care plan. Remember, it's about maximizing the probability of success, not seeking an impossible guarantee. Because in the end, the goal is to ensure that you receive the best care possible and that every effort is made to achieve the best outcome. Instead, ask about what measures are in place to maximize the chances of success. To conclude, it's essential to have an open, respectful dialogue with your surgeon. We've navigated through 6 questions that could potentially hinder this dialogue and could be considered inappropriate or even offensive. Firstly, we discussed the question, will I survive this surgery? This is a question fraught with uncertainty and anxiety which could be better addressed by asking about the risks and success rates of the procedure. Secondly, have you ever made a mistake during a surgery? This question might put your surgeon on the defensive. Instead, inquire about their experience and track record. Thirdly, is this procedure really necessary? This question could imply distrust. A more constructive approach would be to ask about the benefits and alternatives of the procedure. Next, we tackled 2 questions in one. Can I get a discount? And can my family member assist during the surgery? Both these questions undermine the professionalism and integrity of the medical field. It's more appropriate to discuss financial concerns with the billing department and leave the surgical procedures to the professionals. Finally, can you guarantee success? No surgeon can offer a 100% guarantee. Instead, discuss your concerns and expectations openly. Throughout this journey, we've reinforced that trust and open communication are paramount when dealing with your surgeon. It's not about avoiding questions, but rather framing them in a way that fosters understanding and respect. Remember, a well-informed patient is an empowered patient. Ask wisely, and your surgeon will appreciate it.